Okay, we're going to be covering the pelvis today. So this will be in some ways a continuation of our discussion of the abdominal cavity, since obviously the pelvis and abdomen are related. So we'll do a little bit of a review, but we're going to save that for the end. First, we're going to go through a number of pelvic structures, and we'll also be talking about some of the connections between the abdomen and pelvis, and especially in terms of the urinary system. So just a quick review of some of the important pelvic structures, and especially in terms of the bony pelvis. So remember that we have both a greater or false pelvis, which is basically located around the ilium and the iliac crest, and then the lesser pelvis or the true pelvis, which is going to be located below the pelvic inlet or the pelvic ring. So the bony pelvis is composed of the sacrum and the midline, and then the two hip bones or the os coxae, which again are going to be made up of three fused bones, the ilium, ischium, and pubis. And the sacrum itself is also a fused bone. So remember, it's the S1 through 5 vertebra that all fuse together in order to form a single bone in the adult. You remember that you have the anterior and posterior sacral foramina, where the various anterior and posterior rami emerge from the canal, from the spinal canal. And then we also have our four fused coccygeal bones that form the coccyx. So again, that's just going to be one single bone, but there's usually 3 or 4 coccygeal bones that fuse together in order to form the coccyx. And then we have the acetabulum, you'll recall, which is the location, sort of the concavity located within the hip bone where the head of the femur sits. And we can see in a child, before the 3 bones have actually fused together, you get a good view of the triradiate cartilage. So you can see that shown here in black, kind of this Y-shaped structure at the center of the acetabulum. So then you can see the 3 bones, the ilium, the ischium down here, and then the pubis that again all come together to form the acetabulum. This is another image showing us the ilium, ischium, and pubis, and where they're fused in the adult. So again, this would have been the triradiate cartilage in a child, but of course an adult, then they're fused, and so you won't actually see any real obvious remnant of the triradiate cartilage. So here we have a plain radiograph of the pelvis, where we can identify a number of structures. You can see in the midline the spinous process of L5. You can also see the transverse processes on either side of that. You can see the sacrum here in the midline, the ilium with the iliac crest along the top here. You can see the SI or the sacroiliac joint on either side. Again, you can kind of see how they have sort of this curved appearance to them on a typical AP radiograph like we're looking at right here. You also have as I mentioned before, the iliac crest coming around here, where they're going to end at the ASIS, the anterior superior iliac spine. You can usually also make out the anterior inferior iliac spine right about in this region right here. And then the ischial spine, sometimes those can be somewhat hard to see on people, but on this one you can at least see on the patient's left, you can make out their iliac spine quite well. You don't see it so well here on the right. The coccyx should normally be visible, just depending on the individual's anatomy, but in this case you don't really see the coccyx very well. You can kind of make out part of it in here, but again, it's not easily appreciated in this patient. And then we have the ischium, of course, down here with the obturator foramen on either side, and then the pubis bone coming across here with the pubic symphysis. It should be very easily visible on these images. And so you want to be looking at the symmetry of the bony structures in any pelvic X-ray or pelvic radiograph. So you'll look for symmetry of the SI joints, of the obturator foramina. You want to see a nice, closely approximated pubic symphysis, and then you should see a nice symmetrical oval or sort of circular shape around the pelvic inlet. And in this individual, you can see the presence of an intrauterine device or an IUD for pregnancy, for preventing pregnancy in this case. All right, so just a reminder of the difference between a male versus a female pelvis. So it should be relatively easy to be able to determine whether you're looking at a male or female pelvis, even if you can't appreciate their perineal reproductive organs. But in any case, usually you're going to see a more flattened iliac crest or ilium is going to be sort of wider and flatter in a female. So you're going to have a larger pelvic outlet as well. So the subpubic angle is going to be increased. So you can see this orange has a wider angle here, subpubic angle, usually it's greater than 80 degrees. whereas in males it's usually less than 70 degrees. You can see that there in gray. Typically, from a coloration perspective, the appearance is going to be somewhat thin and light on the female pelvis, whereas males are going to have more of a thick and heavy appearance to the bony pelvis. And then in terms of the shape of the pelvic inlet, you should be able to appreciate in females it's going to be more this sort of wide oval shape, versus in female or in males rather, you should see have more of a kind of a heart-shaped appearance to it. So it tends to be skinnier and a little bit more of a heart shape to it. So looking at some other pelvic X-rays here, or radiographs, we can see the superior pubic ramus right here, coming across the top side of the screen here. So again, all this would be superior pubic ramus, ischiopubic ramus down here. You can see that the subpubic angle is less than 70 degrees in this patient. You can also see kind of the approximate orientation of the ilium in this case, and so this indicates that you're most likely looking at a male. And then you can see the ischium obviously coming up right here as well, contributing to the acetabulum, where you can see the head of the femur sitting right there. So here we have the sacroiliac joints, or the SI joints. So you can see those again on either side. You can appreciate it better on the patient's right versus on the patient's left. You do have a good view of the coccyx though in this individual, which we weren't able to see in one of those earlier radiographs. The pubic symphysis is well appreciated, as is the subpubic angle being greater than 80 degrees. You can get a sense of the shape of the pubic or the pelvic inlet here. So you see how it's kind of wider, more oval in shape. So again, that indicates that this is likely a female. And then the obturator foramina are easily observed here as well. So here we see the sacroiliac joints once again on either side. And then pubic symphysis here in the midline on this individual. And again, hopefully you'll notice the subpubic angle is a little bit more, or a little bit narrower here. So, and then you see the iliac bones more in a sort of a more upright position. And so you have a deeper false pelvis, or true pelvis rather, excuse me. And so this is likely a male. There's the coccyx pointed out for you. And so looking at this, again, trying to determine if this is a male or a female, in this case, most likely male that you're looking at. All right, so when you're looking at a pelvic radiograph, again, you want to trace the main pelvic ring. So that's what this upper circle here represents. And then you want to trace the two obturator foramina. And again, they should be relatively symmetrical from one side to the other. If they're not symmetrical, if there's something that you notice on one side and not the other, you should think fracture. Okay, same thing up here. If the pelvic inlet, the pelvic ring doesn't look symmetrical left to right or anterior posterior, you should again be expecting some sort of fracture might be present. So the other thing that you should notice here on it, so again, this is an AP radiograph of the pelvis here, and so the femoral neck should reveal a biconcave outline. So you can see here on either side that you have this sort of biconcave appearance to the femoral necks. And so once again, if that is absent, that indicates there's a likely femoral neck fracture, is usually what that indicates. And then again, I mentioned before to make sure you check the symmetry of the obturator foramina, which in this case, the symmetry is very good. Same thing if you look around the pelvis here, you notice that there is good symmetry from side to side. Okay, so then with the pelvic ring, if either of the joint spaces, so either the pelvic symphysis or the SI joint, if you notice that either one of them is widened, you should be thinking that there might be a pelvic ring fracture, which we call an open book fracture, which we'll look at here momentarily. So you can see the general approximate size of these two joints. So usually the SI joint is going to be approximately 2 to 4 millimeters, and then the pubic symphysis is usually a little bit wider at 3 to 4 millimeters. So here you can see a clear increase in the size of the pubic symphysis, and so this is an example of an open book fracture. So this is common with especially car accidents or high impact injury, common in the military. Like if somebody is, let's say, rappelling down a rope and they fall, it's common to have an open book fracture. A lot of these guys who are in helicopters, they might fall out of the helicopter when they're trying to rappel or just get knocked out. And oftentimes one of the main issues that they present with is a pelvic open book fracture. So in this case, we're also looking at somebody who has a pelvic fracture. So you can see the open book fracture with the widened pubic symphysis. And in this case, they actually have a pelvic binder on. That's what this sort of rectangular shape is the belt component of that. That's helping to cinch it down. And so the reason that we put a pelvic binder on somebody that has an open book fracture like this is due to the fact that you get pretty severe pelvic bleeding in the case of an open book fracture. In this case, this isn't necessarily an open book fracture per se, but instead it's a result of, in this case, it's a postpartum pubic diastasis. And so effectively what happened was during childbirth, there was a fracture of the pubic symphysis, and so that's what caused the widening of the symphysis joint, and so that's why the pelvic binder has been applied in this case. And this just shows you a couple of examples of different designs for a pelvic binder. So over here on your left, you can see this is just with any kind of cloth or fabric. You can wrap it around, tie it real tight, and that'll be relatively effective. These are belt-like binders in the middle and on the right. But again, in any event, you basically are just trying to keep the pelvic bones, the hip bones rather, well applied to each other at the pubic symphysis to try to reduce blood loss as a result. So oftentimes pelvic fractures like this result in very substantial blood loss. In this radiograph, you'll notice that the patient has a fixation device that's been applied in the femur. So you can see, obviously, the screws down here, as well as the upper part of the fixation device looks also like a screw where it's been embedded in the head of the femur in order to help stabilize the bone. You also notice this appearance, or this hyperdensity here in the midline of the pelvis in this patient. And so notice that it has sort of this popcorn-like appearance to it, which is very characteristic of a calcified uterine leiomyoma, which is also known as uterine fibroids. So this image now is showing another example of uterine fibroids, but in this case, it's just a different patient than the previous one. But in any event, again, you get that kind of popcorn-like appearance to the uterine fibroids, and so that's a great characteristic of that condition.